All right, so tonight is sort of like our Life as a Neurosurgeon session. This is another relatively informal one. What we're trying to do tonight is sort of share with you, to be perfectly honest with all of you, we are novices at this as well. We have not done a virtual interview season in the past, but we're going to give you our insights on what we see as important things to think about going into kind of a weird moment in time, and how you can sort of best prepare yourselves for the coming interview season from the perspective of two people at different stages of our careers who will be the ones interviewing you. Feel free to ask questions at any time. I will do my best to monitor the feed while I'm showing these slides. And then we'll also share with you a couple of templates and evaluation metrics that Dr. H has access to through his membership in the SNS, which will, I think, also help guide you a little bit in preparing. So just a really quick overview on application preparation to start. This is something that these may seem basic to you, but believe it or not, these are things that stand out to me and other people who read applications. But don't forget to proofread. Typos to us are a sign of someone who hasn't taken the time to make sure that everything is perfect. And in considering how important this is in your stages of your career, sloppiness at this stage is a suggestion that there will be sloppiness in other areas that are perhaps even more important in the future. So take the time. Things that stand out on an application, and Dr. H, feel free to jump in anytime here. Highlight your interests. And, one of the ways that you can do this is by doing research in areas that interest you, and make sure that that stands out on your application. If you're an active musician or a varsity athlete, these are all signs that you are dedicated to something, and that your dedication to other areas can also translate to dedication to neurosurgery. And we can view it that way. It doesn't have to be all neurosurgery all the time, although there are elements of that help. But make sure it's clear on your application. When we see item after item after item after item, it's great that you're busy, but make sure the arc of the story is clear when you prepare it.
Yeah, let me just add something to that, Peter. Hey, everybody. So I think, we enjoy seeing our applicants do other things. So, if you have a book that your favorite book you put on there, that actually is something that rings true with a lot of the faculty. They'll ask you about the book, because that tells us that you are a more well-rounded individual. And that's really what a lot of programs look for. So don't be afraid to highlight your interest out of medicine, because we want to hear about that stuff.
Another important thing is not to oversell yourself. If you played a certain role in a project, for example, and I'm not harping on research to say that this is only about research, but it's really about anything. If you were fifth or sixth author, you did a little bit of data collection, you were part of a project, but you weren't the person who inspired the project and really drove it, that's okay. But speak to your role and don't oversell it, because eventually it's very likely that the truth will be uncovered, and misleading is a major red flag for us. So just be clear, be honest, describe your role, but don't overdo it. This was something that was said to me a long time ago, which is make your personal statement interesting, but not too interesting. So we want to hear why you want to be a neurosurgeon. If you're a great writer and you want to do that with some interesting prose and some sort of associated anecdotes from your life and stories, great. But it's hard to walk the line, but I will say that excessively artistic can sometimes rub some of the more conservative faculty the wrong way. I personally love to see great writers, but I will say that there are individuals out there who may just see that and say, this is not the person for me. So try to walk the line to appeal to everyone. It's a diverse audience in neurosurgery, so it's a challenge, but I think you can all do it. And then choose your recommendation writers carefully. And this is something I'd love for Dr. H to comment on, but you only have so many recommendations that you can submit. And, you can try to just have the big names write all of your letters, but try to find the people who know you really well and have the ability to highlight your strengths. And also, and this is a little harder because you don't necessarily know how these people write, but find someone who can express their thoughts on paper. Because if they can't, then their points may not come across about you.
Yeah, to add to that, so this year is going to be a unique year, and we'll get into it a little bit more in detail, but you will basically have 2 letters from your institution in neurosurgery, and then 1 from general surgery. And those letters, as Dr. Morgenstern stated, you really need to think about who will be writing those letters. So it is important to have people who are well-known in neurosurgery who, when you read the letter, you'll know whether this is truly a good applicant or not. But as Dr. Morgenstern outlined, having someone who also has kind of been with you from the beginning and can provide some details about some of the things that you've done, your accomplishments, your adversities that you overcame. Those are the types of things that really help. So balance your letters with the appropriate people. This year, you're going to have a general surgery letter too, or some other specialty that you spent time with. And for those who did a research rotation at another facility pre-COVID, they are going to allow a letter of recommendation from someone who was your research mentor. So that's kind of what's going to happen most likely moving forward this year.
Yeah, I think it can't be stated enough times that you need someone who can really clearly talk about you and not just talk about the items on your CV in their letter. Because if they're just regurgitating your CV into your letter, it's just much less valuable. So this is, I think this is the biggest challenge of this interview season, which is figuring out enough about a program to decide whether it's the right program for you without ever visiting it. And that means a lot of things. It means looking at the program in detail. It means thinking about the city or the whatever area, whether it's the city or the country, that you're going to end up in, and trying to figure out whether it's the right place for you to be for 7 years, because it's a long time. Before I go on to this, we have a question that I'll just answer now. It's how many publications are required in order to be competent as an IMG applying for the U.S. residency program? So there was actually a study on this, I think, that was published earlier this year or last year. It's hard to set a number to this. They did mention that I think it was actually, re-applicants. It was applicants who didn't match for the first time who reapplied and were successful, had an average of about 20 publications. I don't know if there's any comparable study for first-time international medical graduates. I will acknowledge that the number is probably higher than for U.S. graduates. I think shooting for 10 to 15 publications is reasonable, but your number of publications is one element of your application. At least for the moment, we still have USMLE scores to work with. Your publications, if you spent time in the U.S. doing rotations, letters from those rotations are helpful because they speak to the quality of the work that you do in real time in the clinical environment. So I think all of those pieces are important. And then in terms of what number author you are, it's always better to be a first or second author. But we all know that not every medical student is going to be a first and second author. And so if you're further down the author list, just make it clear what role you played in the project. And higher impact papers, we also know that you're going to be further down the author list on a high impact paper because that's just what happens. Whereas, a case report or a smaller case series, you're more likely to play a more prominent role. So in learning about a program, always start with the website. I'll be honest, the website, depending on the program, can be really robust or really limited. But it's a good place to start to just get to know the structure of the program, how big it is, where the rotations are, who the faculty are, what kinds of subspecialties are covered by those faculty. It's a little harder to get more granular from the website. Some programs produce a brochure that may provide more information, which is also helpful. Social media, I hesitated to even put this on the slide, but it's so prominent these days that it is a good thing to look at, as long as you digest it carefully. So recognize that the social media profile of a program is a curated version of what the program is. So it's what the program, I mean, it's true for us, it's true for everybody else. It's what the program wants you to know about them. It's not what they don't want you to know. So it's valuable for gathering information, but just keep in mind that it's mostly the positive and you're not going to see the negatives. I think the best source of information about your training experience is going to be the residents. If you're able to get in contact with the residents through the program, and generally contacting the program coordinator and asking for a couple of resident contacts will get you the email addresses or phone numbers of those residents so that you can learn a little bit more straight from the horse's mouth, so to speak, about what their experiences are in training and the ups and the downs. They're more likely to be honest with you, I think, than almost anybody else out there. Personal connections at a location. This really is, at this point really refers to getting to know the place. If you've never been to Atlanta, or you've never been to Chicago or Iowa or Nebraska, you know, we don't all know people in those areas, but it may be helpful to try to find a way through whoever your personal network is to find somebody, even if it's a 5th degree connection, to tell you more about what it's like to live there. 7 years is a long time. It's good to get to know as much as you can about a place, especially if you can't visit it. If you are able to go visit it, I know that we're not really allowing program visits because that creates unfair advantages for people. But if you can go visit the city, if it's safe to do so, I'm not encouraging anyone to go against travel guidelines, but if at some point during the interview season it is safe to do it, it may be worth your while for some of the programs near the top of your list. But you know, you do what you can and you do what's both safe and financially feasible and everything else. Virtual tours and visits are one step better than social media, I think. They're still curated. They're a little less curated. I know that at least at Sinai, we're planning on having a number of sessions in the fall with the residents sort of leading the way, sort of similar to some of the Q&As we did earlier in this, but more during the interview season for applicants, to just get to know more about the program, sort of like a virtual, whether it's a happy hour or a Q&A session or just something where you can learn more about how the program works. And then I've seen a variety of programs out there doing sort of miniature virtual sub-Is, whether it's a day or a couple of days. I don't know if they're sticking a GoPro camera on a resident or if they're just doing short videos to show what life is like there. You know, essentially this is a way of saying gather all the information that's available to you about the programs that you're most interested in. We acknowledge that it will be limited this year, but there will be stuff out there. And then the pitfalls, I already talked about some of these, but it's challenging when you can't visit a place to decide whether you can live there for 7 years. So use the information that's available to you. I think the biggest challenge, frankly, is this last one, which is the absence of the ability to sort of take in the quote vibe of a program. When you're walking around, you're taking the tour, you're getting to know the residents, you're just spending the day with them, you get a feel for a place. And I think that to some degree, we can use these virtual visits to substitute for that. It's never a perfect substitute. But if you can do the best you can to sort of immerse yourself for that moment in the program and think, well, could I spend 5 years, 6 years, 7 years with this group of people? Is the training environment that they're describing one that is appealing to me? That's ultimately what you're looking for in a program.
Yeah, I just want to add to that. So the fit factor is what you're really looking for, you know, as you visit programs. And unfortunately, that's going to be the challenge this year is how do you determine whether you fit in that program? And, you know, it's just going to be gathering all that information and talking to the residents and trying to interact with each of these programs you're interested in as much as possible. But there's going to be a challenge this year on figuring out that part where, whether you feel like you could be part of that program or not.
Somebody asked a question about additional degrees for applicants, masters of clinical research or science, PhDs. These can all be positive. They can also be negatives depending on what they are and what you do. So as a piece of the puzzle, if you have if you've done a really good PhD and you've done interesting work and you can speak intelligently about it, and you have a reason for doing your PhD and a reason for going into neurosurgery thereafter, that's a great application. If you did a PhD and you don't seem like you're particularly interested in clinical medicine, and you don't seem like you're going to be a good clinician in the interview, then that's not necessarily an applicant that the program wants. So it needs to be in context. And this is my last slide before we can just answer questions. The interview. So virtual interviews are, as I'm learning myself, frankly, through this whole Zoom process. At Sinai, we've been doing largely Zoom meetings for almost 4 months now. And I think we have all learned a great deal about what it's like to be on conference calls and in virtual meetings like the lawyers. So the couple of things that I've learned that I think can translate to you is number one, professionalism. Professionalism applies in anything that you do, and it particularly applies in an interview, whether you're in person or not. This means a number of things. I'm going to list a few of them, but number one is the environment. So if you're sitting in a messy room and your dog's jumping in your lap and you've got an open bottle of wine behind you, might not be the best place to be doing your interview. Clean the room in which you're working. Try to minimize the distractions in the background. Try to minimize the outside noise. If the subway runs right by your window, the elevated train or something, maybe try to find a different room if it's possible. Create a quiet and organized environment in which to do this, and make sure that your technology is working. How you dress for a virtual interview the way you would dress for an in-person interview. I'll say it again. Dress for a virtual interview the way you would dress for an in-person interview. Don't wear a ripped t-shirt. Put on some appropriately professional clothes and show up. And lastly, behavior. We are all relatively self-conscious, I think, in interviews when we're in person. Maintain that same self-consciousness when you're on video. They see everything just as they would if you were in person. So just be aware where your hands are, be aware of what you're doing with them, and try to look into the camera. Like, for example, what I'm doing right now, I positioned my for most of the beginning of this, I positioned the bar where I see all of your faces off to the right of my screen. So I haven't been looking into the camera. But one useful tip, which I'm doing right now, is putting all of the pictures across the top so that you can look more at your camera and you can have more eye contact with your interviewer. And actually, with the interviewers, it's probably a little easier because you'll have maybe anywhere from 1 to 3 of them at a time rather than 40.
Yeah, the other thing I would add is just, we're always waiting to respond to people, and we're not really listening sometimes to what's being asked. And certainly when the interview date comes around, you're going to be nervous. So you're going to want to just rattle off everything about yourself, and you've done a lot of great things, and we want to hear about that. But I also want to see who's actually listening to the questions and answering the questions. So try to listen and then try to respond accordingly. We do want to see enthusiasm and excitement, and that's obviously very important. We want to see who's got the energy to go 7 years in neurosurgery. So enthusiasm is really important, and smile, when appropriate and so forth. So just show your energy to the group, but also make sure you understand what's being asked of you, and try to answer appropriately.
Just to dovetail off of that, Another important thing, just from a logistical perspective, shut off your phone during your interview, so it doesn't distract you. And if you happen to have all Apple devices that talk to each other so that all of your iMessages show up on your screen and ding, shut it off. Because the dings are annoying and they'll hear it through the screen, and they'll also distract you during the interview. So try to disconnect that function during these interviews. Preparation. So this goes back to the last slide. Learn as much as you can about a program before you get involved in the interview. If you don't know anything about it, walking into the interview and you ask a bunch of questions that they view as you not really doing your homework, they're going to translate that to, oh, well, maybe he or she is not going to read about the case in advance when they're a resident. So keep that in mind. Get to know as much as is available. At the very least, read the materials that the program has put out about the program, because that's sort of a basic baseline. Come with questions. This is something in my first residency interview, I didn't do this and I felt like a fool. They asked me in my first interview, so do you have any questions? And I blanked. I said, well, no, I guess I don't have any more. Always have a question. As silly as it sounds, they could have answered literally everything that you want to know, but just have something else to ask them, even if it's just one. And be ready to answer the basics. These are 3 questions that almost everyone at some point will ask you. There are lots of other questions out there, and I would love for Dr. H to chime in on this one as well. But why do you want to go into neurosurgery? Just be ready. Everyone's going to ask you. Why do you want to come to this program? And what other programs are you looking at? And what do you like and dislike about them?
Yeah, I really like that last part. So normally, you know, when you'd rotate, you'd like or dislike certain things about programs. And I always enjoy hearing what you liked about each program and things that you just didn't like, because that tells me kind of what you're looking for and whether, you know, we are a fit for you or not. So, you know, just be honest. I mean, you don't want to go around bashing programs. There's ways of saying things that you like and you don't like in a way that's respectful to programs. So, you know, we're not looking for people who are just, you know, bad mouthing other programs, residents, et cetera. Just don't do that. But, you know, I do think you're entitled to your opinion. You know, there may be a program, for example, that's all clinical and doesn't have much research opportunities. That may not be a good fit for you, and that's okay. We can hear that, and we know a lot of those programs that have those types of training programs. So these are some of the things just think about as you look at each of the different residencies around.
Yeah, I think that there are ways to say negative things about a program in a nice way. So just be ready to do that, because I think from like a tone perspective, a lot of negativity in an interview, even if it's not about the program itself, it just makes it creates a negative vibe to the whole interview, and the interviewer walks away and they think like, it was everything was kind of down about that interview. Right. Whereas if you have generally a positive outlook, even if you say some negative things, it just works better. And then follow up. When you're done with an interview, follow up with the program. If you don't follow up, it's a suggestion that you're not interested. So it means at the very basic level, it means sending a thank you note to the program director. A more advanced level is sending individual notes to a handful of the faculty, or in some cases, if you're really effusive about a program, maybe sending notes to all of the faculty that you interview with. I will be perfectly honest, this is exhausting. I remember writing all of these notes when I interviewed for residency, when I interviewed for fellowship, and it drove me mad. And trying to find new things to write to each person is crazy, but it helps. It shows them you're interested. When they come around and sit together in a group talking about you at the end of the season, they say, I remember that applicant, she wrote me a really nice note. And then 5 other people in the room say, oh, she wrote me a really nice note too. What did they write to you? What did they write to you? So think about it. It doesn't mean you have to do it for every single one, but for the ones you're really excited about, I would take the time.
Yeah, and I think there was a question actually about email versus handwritten notes.
I see that.
I think an email is fine. I think that's okay in this day and age.
Yeah.
The handwritten notes is a little more time and energy, and that's also nice, but I don't think it's necessary. I think a nice email works just as well.
Yeah, I would totally agree. If you have, my only caveat to that is if you recognize that the program director is on the older side, it might be nice to write a handwritten note to that program director, just because of the norms of our different generations. Most of us view email as just fine. But I would say that if your program director is over the age of 60, you might consider writing a handwritten note to them. It may be an ageist comment, but I stand by it.
I think they know how to read emails by now. So
yeah, no, they know how to read them, but
yeah, I
in
see what
terms
you
of
mean.
the people who appreciate them, I think would be in that
Yeah,
generation. Although for the most part, honestly, we all like email. I think you can stick with that.
understood.
And then maintain contact. The programs you're really excited about, as it gets closer to match time, remind them of your interest. Even if you sent a thank you note, and you sent the thank you note right after the interview, but then when February comes around, reiterate your interest before they submit their rank list. And that's all I have. We were going to go over. Do you want to take them through some of these templates you sent me?
Sure. Yeah.
Which one do you want me to bring up? You want me to start with the milestones, maybe?
Yeah, we could do that. Well, show the letter first, and then we can do the milestones afterwards.
Okay. The general surgery or the neurosurgery one?
Let's do neurosurgery first. That's
okay.
General surgery, very, very similar to that one.
Yeah.
So, one of the things that the Society of Neurological Surgeons, which is our governing body for residencies, is how do we kind of evaluate students in an equitable way, since we're not able to see people physically this year. So this was the template that was kind of agreed upon by the leadership in the SNS. And it's very straightforward. I don't think there's anything here that's surprising. That we want to know kind of how you are with patients and your medical knowledge. Maybe you've done some procedures, a lumbar puncture, maybe you helped with an EVD. Your research is really important. That's something that we're going to look at. And of course, how you talk to people and you communicate and treat others is really something that's important, and we weigh a lot to that. The coachability is one that I also wanted. We had a discussion about this as we were putting it together, and some said, well, maybe we shouldn't include this, and then others said we should. And I felt that it was something good because, look, we all make mistakes, and you're a medical student now. You don't know neurosurgery. I mean, even your first year when you started your second year, you're not going to know neurosurgery well. But can we teach you neurosurgery? That's something that is important. And can we sit down with you and provide feedback to you in a way that you don't get upset? You actually listen to what's being said to you, and then you try to change. And that's what coachability is all about. It's how you're going to respond to criticism. And sometimes that criticism may come out in a tone that's very negative, and that's just how it is sometimes. I mean, we're always running around. We have stuff that happens, and sometimes we don't choose the right words that are sensitive to you. But you need to be able to respond to that in a way that we know you're going to try to do better next time and learn from your mistakes. And that's really important, I think, as you move along in any profession, is how you can avoid making the same mistakes over and be better. So that's kind of what we're doing. There's the box with the top 1%. So that's going to be somebody who's just really nailing it out of the park. Most people are probably going to be, 6 to 10%, or maybe 11 to 25. Those are probably, to get a bottom 50%, that would probably not be that many people. And I would suspect I wouldn't see that box marked maybe once or twice, or not at all. So
I
that's
would,
kind of, yeah. What do you
I
think, Peter?
personally, well, I personally would hope that your mentors are honest with you. So if they are going to write something like that, then they might be, it might, if they're honest with you, they'll be sort of coaching you out of neurosurgery potentially. Um,
Yeah.
if you're not the right fit, if they don't feel like you're the right fit for the field, it would be better for them to tell you that than to write a bad letter for you.
Yeah. So, and then, at the bottom, you can scroll up a little bit. It's just, some other things that we can, that we can just kind of define you with, your guidance, how you're going to do during residency, and, just how you did compared to other people in the last 5 years. So, these are some of the things. And then of course there's going to be a part where we can, write some other parts about you and your background. And that's where like the mentor you've had is really important here. The mentor who's seen you take projects and finish them, or who's seen you kind of, make a mistake or fail, but then bounce back and do something great. That's the kind of stuff that we're looking for. Adversity, enthusiasm, someone who finishes projects. That's another thing. Like, there is a tendency for medical students and even residents to just sign up for a bunch of things but never get anything done, and that's just not what we want. We want someone who takes the project all the way through the goal line, finishes it, and scores the touchdown. So those are important concepts to keep in mind.
Before I open the next document, there's another couple good questions. And these are about personal statements. So, there's it's really the same question, but the don'ts in writing a personal statement, and should they be more academic or more personal? I think you can take, to answer the second one first, my view is that you can take either tact or both. So you can start with a personal story that then branches out into your academic achievements. Don't just summarize your whole application in your personal statement, because it's really your one chance to write something different. You can go into greater depth about something or two things that are in your application, but it's not exactly like a cover letter for a job where you're basically summarizing what you've done and how it's relevant. I think that writing about your immigration story, or writing about an illness that drove you to go into medicine, or I'm not trying to put words in your mouth, but defining moments in your life that have helped guide you, if you have those. And if you don't have those, then what are the things that drove you into the field? That's ultimately what we want to know. What do you think?
Yeah, I agree completely. I think try to, we're going to get the medical background part of your application through your transcripts, your board scores. I guess this year it's going to be pass fail, or and then, other types of things in your record. So I look at it as a way, a picture of you as a person and some of the experiences that have defined you. You don't want to get overly philosophical, as Dr. Morgenstern mentioned earlier, but it's your chance to kind of highlight yourself and kind of how you see yourself moving into the field, and maybe some of the driving reasons that pushed you there in medicine and neurosurgery. So that's kind of our way of getting an idea of how you are as a person.
I think my two biggest don'ts to answer the first question are: don't ramble. So run-on sentences and just going on and on about one thing when you can be more concise are don'ts. You'll lose the attention of the reader, and then they'll give up. We all have pretty short attention spans, except when we're in the OR now. So something to think about. And then the other don't, for me at least, is try not to be negative. If you're talking about something that you didn't like in your personal statement, don't linger on it. Because just like with the interview, negativity has a way of sort of poisoning the reader or the interviewer to you, because they walk away with just a negative feel for everything that you discussed. And then as the details fade away, as they ruminate about your applicant status, and all they're left with is just a negative feel, and that's not good. So keep it positive, keep it upbeat. If it sinks into a tough time in your life during the story, that's okay. But find a way to come out of it.
Yeah.
Let me open that milestones thing. The general surgery letter.
Pretty similar.
Yeah, it's very similar. I think one thing to mention about the general surgery thing is lean on your neurosurgical mentors at your institution to find a general surgeon who will do a good job. If you don't have one already, have them help to find one who will write a letter well for you and take the time to do it well. If you already know somebody, that's fine too. And then the milestones, let me just open that. Okay.
Yes, but these are just some of the things that, you know, we could look at here, but these are guidelines for how to rank you based on some of the criteria and topics that we talked about in the letter of recommendation template. So this is, you know, for medical knowledge and patient care. As you go to the top 10%, I mean, you can see as you move to each category that it kind of goes down. So this is probably just something you could use as a guideline. Again, you know, it's going to be hard to see recommendations for people in the bottom 50%. I mean, I think you're going to be all probably in the top 26 to 50% here. And, you know, it just goes along with each of these: medical knowledge, procedural aptitude. Again, how well are you able to understand bedside procedures, and, you know, can you perform them well? Are you someone who could do something rather independently? We're not going to let you do anything completely by yourself. I mean, you shouldn't be doing things by yourself. You should be having someone help you and guide you through it. But that includes in the operating room too. So, you know, are you able to, you know, help with suturing? We don't expect you to suture perfectly, but, you know, can you do some things with that and follow the surgery and be a good assistant? I mean, right now your goal is to be a great assistant. How you can think things and how you can be there to help with each step of the surgery is kind of what your role is as a medical student at your institution. You want to go to the next one, Peter? Just scroll down.
Yeah, sure.
It's okay. You know, professionalism is really important, and that's really how you present yourself, how you listen to others, and how sensitive you are to others. I think that's a sign of maturity. Are you somebody who just kind of expresses their thoughts and opinions, but has no concept of what everyone else is thinking or feeling? And, you know, are you down, you know, discussing other people in a negative way? I mean, you should be optimistic, really focus on all the positive things around you, and really stay away from any bad, negative verbiage about anybody around you. I think that's just, you can't do that at your level, and nor should you, you know, later in your career as well. So very important, just, you know, how you deal with other people, how you communicate, how you articulate, you know, what you're thinking. That's very difficult sometimes in neurosurgery, especially if you don't know neurosurgery. How are you going to articulate something in terms that neurosurgeons are going to be able to understand you? So that's something that you're responsible for learning. And at the end of the day, you know, we want people who are also, you know, looking at evidence-based medicine and how the literature supports certain things and doesn't with other things. And we don't expect you to know everything with journal articles, but have a good idea and be well read with, you know, some of the more common things we do in neurosurgery.
So I think that's all we have for materials to present. We can open it up to some more questions if anybody has them.
Yeah, please don't be shy. I mean, just let us know what you're thinking.
We're here as a resource tonight. And if you want to ask a question out loud and you're not on the panelist list, just go ahead and raise your hand. I can give you speaking privileges.
I can, while we're waiting for some questions. So one of the things that, you know, I'm sensitive to is, or, you know, we have pre-resident fellows in our hospital, and they're great. And, you know, they are looking for spots in neurosurgery. I know that in our participants here, we have some 4 medical grads. So, you're in a different pool of the applicants, and I think we're looking for those applicants who've had some clinical experience, and certainly pre-medical pre-surgical fellowship is helpful because we've seen how you interact with patients, emergencies, taking call, and that really can separate you from another foreign medical grad who hasn't done that. It's just another way to really understand how you're going to do as a resident when under stress, when taking call, managing different things, and putting out fires. So those who've done those types of pre-resident fellowships have kind of survived through that first wave, and I think that adds strength to their application. And then I think having more publications than a typical applicant as a foreign medical grad is probably going to be helpful at the end, because you do have to make up for some other things that the American graduates have going for them. So those are some of the points that I think about with those applications.
We had a question from Redwan. Go ahead.
Yeah, thank you. Hello, my name is Redwan. Thank you so much for the great panel. I'm a graduate from Poland. I'm in the process of preparing myself to get into residency. So I'm really curious to know what are the chances to get into your neurosurgery program in the States, because I have, reading a lot of reviews, and also I talked to so many people that it's almost impossible. And somehow looking to the statistics, it just makes me feel somehow hopeless to try to stay actually. Thank you so much.
Yeah, let me take a stab at that. So kind of carrying on what I said earlier, I think as a foreign medical grad, you have to prove yourself in some way in this country. And the way that works is commonly, performing research for multiple years in a department, going to department grand rounds, interacting with the faculty, going into the OR and volunteering when you can. And then, I think if you have the opportunity to do something like a pre-residency fellowship, then that adds a little bit more strength to your application. I think believing that you're going to match in a neurosurgery residency from outside of the U.S. with no track record or experience in the U.S. I just don't think it's going to happen. I think it's very difficult for that to happen.
Yeah, I agree. I think most of the applicants that I know who have made their way into U.S. residencies from outside the U.S. have done some form of, it's not necessarily a pre-residency fellowship, but maybe they've spent some time here and done some research or a clinical rotation. There's a lot of literature out there on matching and competitive specialties from outside the U.S. And to be frank with all of you, it's an uphill battle, but you do your best to craft your application in a strong way. And I can think of at least 6 people I know who came from outside the U.S., but they all faced tough roads, and they did a lot to make their way in. You're welcome. There was another question. Any advice for someone who went unmatched and currently doing a prelim surgery year? I would don't submit the same application you submitted last year. Show that you have matured, grown in some way, whether it is by publishing more or by learn what you've learned during your prelim surgery year, what skills you've acquired. It is, my view is, without a doubt, you are a more mature individual a year later after spending a year as an intern in surgery than you were as a medical student. So speak to that. I think that helps. And also, why do you want to switch, or why are you still coming back around to neurosurgery? What makes you so passionate about it?
Yeah.
And get good letters from your surgeons that you work with. Let's see.
Sorry, just one last question. Okay.
Hang on one second, because I have a very quick one to answer. If your step 1 is below average, but your step 2 is much better, do we take that into account? Yes. Improvement from step 1 to step 2 is a positive. Go ahead.
Yeah, thanks. Thank you. So So having the chances of doing residency fellowship or doing postgrad, doctoral, like as research or studies. So which one is easier to get into? Because I'm not so much into, I'm not having knowledge about these programs.
Which one? Sorry, which what's are easier to get into?
Sorry, doing the PreResident Fellowship and also having post-grad doctoral studies. So which one is easier to get into to try to start with?
I think either is fine. I think you can find both all over the country. The challenge is finding a good one, finding a good mentor. Um, I don't have a ton to say about that because I frankly don't know the landscape of it that well.
All right, excellent. Okay, thank you so much. Okay.
Let's see. Does the type of publication matter? Any publication is good. Higher impact publications and original articles are better than case reports or small case series. But any article that you write is a positive for you.
Even review papers, right?
Yes, anything.
Okay.
Kamal, I see your hand raised. Go ahead.
Hello, thank you so much for arranging this session and answering our question. So can you please elaborate a little bit on the template that you showed earlier? Is it mandatory that all your LORs, all your attendings that you have been contacting, they have to fill it out? Because I'm an IMG and I'll be asking attendings in terms of a research letter because I'm doing a research fellowship here. So they might not be able to comment a lot on my clinical skills. So what do you suggest is the best way to go about it? Thank you.
That's a good question. Do you know, are they expecting that every program is going to use that template?
Well, I think it's a template that can be used for guidance. So tell me again, Kamal, you're not. Tell me what your background is in regards to rotations. You're not able to do.
Sure. So, sorry. Yeah. So I am an IMG. I'm an international medical graduate. I earned my medical degree from Pakistan. At that time, when I was a medical student, I did do a sub-I here in USA. But it was like a few years ago. So right now, currently, I'm working as a research fellow at Barrow Neurological Institute. And I'll be asking my mentors to write me a letter, but their letter will be more focusing on the research experience since I'm doing research here.
Right, so that's where I think you're probably going to need to go look at your mentor of Pakistan to write you a letter too. Someone who knows what you've done clinically. I think you may have to think about that. I mean, at Barrow, your research is going to be important too, but there has to be, that's the part that I was trying to stress for the foreign medical grads. There has to be something that comments on some of your clinical abilities in neurosurgery. And I think that's where the rubber hits the road because, in this current situation, we can't do rotations per se. But you could do an observership at the BNI, right?
Yes, I did an observership in 2018 at BNI. So do you think, because observership doesn't technically have a hands-on experience, so that's what my concern was, that does it have to be a hands-on experience?
Well, I don't know if it has to be completely, but at least it allows the person assessing you whether you've been able to interact with patients appropriately, how your behavior in the OR is, your medical knowledge. So there's ways around it, even though you haven't technically touched patients, you're around patients, you're around the team. So they should be able to assess some of those points there.
Okay, that sounds good. Thank you so much.
Yeah.
Thank you. A few more questions in the chat box. So one was about sort of impressions of you and your social media profile and whatever else is public about you. My answer is anything that you put online can and will be used against you. So keep in mind when you're on social media, any comment that you make, public or private, can often be found by someone and may be judged either positively or negative. So just think negatively. So just think carefully about what you post online. It's been true pretty much since the founding of Facebook back in 2004, and it will continue to be true. And many people have not learned that lesson, including our chief executive here in the United States.
Master, this is Clementine. Can I ask a question, please?
Sure.
Yeah.
Yes, so I was curious to know, I had reached out to Dr. Panov, who you had mentioned runs the pre-residency fellowship, and he indicated that there's no, well, I wouldn't say no selection criteria per se, but there's no separate application apart from your residency application. So I know that we're going into applying for this cycle, and for applicants who might end up unmatched, he mentioned that those applicants are considered for the pre-residence fellowship. But I just wanted to know, I mean, when you don't get matched the first time around, it kind of like has a weight on your future applications. And so if you have to wait to not be matched, to get into the pre-residence fellowship, isn't that kind of like a risk? What are your thoughts?
That's a good question, Clement. Is it Clementine or Clementine?
It depends. In French, it's Clementine. In English, it's Clementine. So.
Okay. So, there's some strategy to that. So when the pre-resident fellow comes to us and they start, ideally, they would want to have a letter written as they begin. That way they can enter into the match during their pre-residency fellowship year. The challenge, however, is we don't know that pre-residency fellow within that first month. We need them to really finish their year with us so we can truly assess their performance and how we believe they'll perform in neurosurgery as a resident. So what I recommend, and unfortunately it's another year, is that we write the letter at the completion of the pre-residency fellowship year. And then, there's a gap year, or you spend another year as a pre-resident fellow, helping in some other way. So it does add an extra year, but I think it does add more strength to the letter because, you've been you've battled in the trenches, so to speak, and you came out and you survived. So, that adds a lot of strength to the letter when I write it, and that's what I look for. Does that answer what you were thinking, Clementine?
Yes, definitely it does. Thank you.
There's a question about navigating the line between appearing overeager and reaching out to programs. I think that if you contact programs after you've interviewed and then once again in January or February, I think that's good. I think more than 3 contacts with the program may start to get a little bit aggressive unless you're in the process, unless you're in, a conversation with a faculty member and you're back and forth with them a number of times. Eagerness is okay. But yeah, I think if you have social awareness, your feelers will start to go up when you feel like you're crossing over a line, and you'll navigate that properly. This is a really good question. So do you anticipate that virtual interviews for a given program will be completed in a single day, similar to previously, or will virtual interviews with faculty be spread out? This is such a good question that I don't know that either of us know the answer. I think every program is going to do it differently. I know our program director and I have talked about this a little bit, and we haven't come to a conclusion about what we'll do. I suspect that most programs will consolidate their interview days as they have in the past because it's what the faculty are used to and what they can schedule around. But frankly, your guess is as good as mine.
Yeah, right.
Yeah.
It's hard to know.
It's really tough.
Everybody.
Zoom background. If you have even if you have a blank wall that you can sit behind, that you can sit in front of, that's good enough. Just the neutral background. I mean, I'm sitting in front of my curtains, but you can do any number of things as long as it's uncluttered. That's probably the best that I can do.
I have a question for you, doctors, before you leave.
Go ahead. I think this will
So,
probably be our last because we're running out of time.
okay, thank you so much for your time and explaining all of this to us. This is extremely informative to all of us. So my question is in regards to the time expended doing external activities like research or a PhD. So do you take this into account on the applicants when they submit the application, even though they finish their med school several years after that submission? I don't know if you get my point. So there should be a kind of gap years between the med school and the application, and in between several things were done. So would you take this into account when assessing the applicants?
Yeah, no, I think, you know, if you're coming from another country, like we talked about, I think it's a very good idea to plan to do 2 or 3 years of research, really kind of get in to a place and you know, publish, be part of the department, interact, and really develop, you know, a foundation so people know who you are. As an American grad, I don't know if it's necessary to take more than 1 year off as a gap year. You know, I think having a year of research is fine, and I think that adds strength to a program. But, you know, I don't know if it's necessary. Does that answer the question?
Yes, sir. Thank you very much.
All right, so we're going to wrap up there. Thank you, everyone, for participating. We have 2 sessions next week, and those will be our last 2. We have Skull Base on Monday with Dr. Shrivastava, and we have Epilepsy and Neuromodulation with Dr. Gatan and Dr. Panov next Thursday. So thank you all, and I look forward to seeing you next week. And thanks to Dr. H for taking an hour out of his evening to join us.
Thank you, everybody. Have a good night.
Thank you, doctor. Have a
Good luck to everybody.
Good night.
Good night.